Wow, what a wonderful gathering. Sarah Jane, thank you so much. I want to say I don't think we could have a better person to chair the Transformation Board. And that is really good. Your commitment shines through. Your experience recently, I think, is hugely valuable. And I love your phrase, and I so believe it, that we at last have a chance to influence the next generation. And that is what we are about. I want to start by saying that our ambition for Better Births, while we were thinking about the report, what we wanted to do, we wanted to ensure that our services in England are among the safest in the world. And we do start well, because we know that the services in this country have never been safer. Stillbirths, neonatal deaths have fallen by 20% in the last 10 years. Maternal deaths have never been fewer. And we just know that the vast majority of women and their families experience birth as a very joyous occasion, a time for celebration. However, of course, we do know that things can go wrong. And when they do, it is simply devastating for those families who are concerned, obviously for the parents, but wider, the friends as well as the families. It's a tragedy, and we know that for many it is a scar for life. So we have got to do better. We must make giving birth safer compared with the other countries in Europe. If we were doing as well as Sweden, which is the safest place in Europe to give birth, we would be saving 1,000 babies every year. So we know that it's good at the moment, but it's got to be better. In the 5-year forward view, Simon Stevens promised that there would be a review of maternity services, and he invited me to chair it. And it's been a great privilege. And so the first thing we did was get together our team, and we set out the values that we wanted to ensure, values that we felt as a team were important. We wanted our services to be personalised. We wanted them to be family-friendly, safe, kind, and professional. So these were our thoughts, but that is nowhere good enough. It's very easy to make assumptions. I have a label. I am called a Baroness, and people assume things about me. I am rich. I wish I was. They think I live in some great country pile. I live in a modest Tudor cottage. They think that I have a flashy car. Gosh, I wish I had. So these assumptions are made, and it's very easy to make assumptions. But if you look at other areas, other organizations, they do a lot on market research. So we said, right, we're going to find out exactly what women in this country want, what they think is important to them, what they feel is important to them. And so, as Sarah Jane said, we went round the country, and we had the drop-in events that were very, very informal. They were not in NHS premises. They were where women felt comfortable. But we not only had the women, not only their partners, but we also had a lot of midwives, obstetricians, GPs, anaesthetists. All sorts of people came to these events. And in the middle of this picture, you'll see a very smart woman in a black suit, and she was the local MP. So we did involve a huge number of people. We also did online surveys. We had 2 birth tank events, which some of you, I know, were there for that. So in addition to that, we also had service visits, and we were looking for the best. We were trying to find out in this country where the really good things are, so we could learn from those. And I do want to thank all of you who hosted us. We could not have been more welcomed, and we could not have met more inspiring people. It really was just wonderful. So we were doing all that, going around the country, talking to people. What do we hear? Well, from the women told us that they wanted choice. They wanted their decisions respected. They wanted continuity of the people looking after them, the professionals. They wanted a safer service. They told us to wake up to technology, and they told us that we should embrace it, and that their lives were in their iPhones. And where were we? We were in the dark ages. They told us that they wanted the labour wards to be open. And I have to say, I've been quite shocked. Quite recently, we had something in the House of Lords, a member of the House of Lords asking a question about the number of times in his local hospital the labour ward was closed. We also they wanted competent, kind, skilled staff, and they wanted services nearer to home. And when things go wrong, they want prompt action. And they also talked a lot about after the birth, and they wanted postnatal care. Dads told us very often that they were ignored, and they wanted to feel much more part of the event, and they felt it was a life-affirming event, and they wanted that to be recognised. Health professionals told us that they valued great leadership, that they valued respectful team working. They wanted more autonomy over their work, and they wanted more professional training and education that was multidisciplinary. They told us there was too much form filling, and we did sense on our visits that there was a thirst for change. Commissioners told us that the payment systems weren't working. They were totally inadequate and very often a barrier to really progressive new types of maternity care. The tariffs needed to be sensitive. They felt that categorizing women, as we do in high, medium, and low risk, was really unhelpful. And they really wanted to ensure that the rural areas were also looked after. So we heard all that. And we then said, right, well, things that we're going to bring into our report are certainly personalised care. Personalised care centred on the woman, the babies, and the families. And that requires a care plan. And the woman drawing up her care plan needs to ensure that there's unbiased information so that she can make a choice that is suitable to her, but also is well informed. We also felt it was important to have a digital maternity tool so that she could have access to her record and even put in her record, and she should own her record. And Sir Cyril will be saying something about that later on. They wanted to choose their provider, and for that we have introduced this idea that Sarah Jane talked about the pioneers, the system whereby women can hold their own budgets. And we've got a table here today where we can explain how that's going to work. Because at the moment we've got 7 different groups of CCGs around the country who want to explore this area and really try and see how we can give women greater choice. We found that choice was actually very much wanting, and that 87% of births are in obstetric care, and actually 25% of women told us that was what they wanted. Now, there are reasons, obviously, why some women have to have birth where they haven't planned. But what was really staggering was the MPU told us that 33% of women got no choice at all. Now, we choose all sorts of things in our lives, how we live, where we live, what we eat, etc. And yet this very seminal, very important event, there is little choice. So it's not just about place of birth, but it's also about the choice of the provider and also the choice of the type of care that women want. Relationships, we feel, are terribly important. Continuity of care, difficult. We know it's difficult to introduce. That doesn't mean to say we should shy away from it. We're looking at teams of 4 to 6 midwives and listening to women. I remember one who told me she had had 43 different health professionals during the antenatal, birth, postnatal care. 24% of people, women who get continuity are less likely to have a premature birth. 24% if you can get this relationship working. What a difference that would make. In the heart of our report, we've not only got choice, but we've also got safety, safer care, and Sir Cyril's going to be talking about that in a minute. We also heard a lot about the need for better perinatal care. And the Mental Health Task Force has got serious money, and they are taking on this issue, but we will be involved with that to make sure the right decisions are made. And also, of course, very important to have postnatal care. I just think, your first baby, it really is a struggle. You don't know what this creature's going to be like, really. Always crying, always needing feeding, all this stuff. And that is just so important, and we have to address that issue. So multi-professional working, I'm going to leave to Cathy Warwick and David Richmond, who are going to talk about that. Working across boundaries, we think, is hugely important. We're talking about setting up maternity hubs, and we see these as really vibrant places where you can bring all sorts of other activities in there. And sometimes perhaps cited in, as we have seen, in a GP practice or a children's centre or community centre or wherever. So it's to bring all these different helpers, in a way, together. We see, in addition to that, bringing the hubs together. We really want, and we're very lucky about this, the local maternity systems. The local maternity systems, we set out a population of between 500,000 and 1.5 million, and it pretty well exactly matches the SDP footprints, which is really lucky and good news. And in addition to bringing all those services together, the local maternity services, into these clinical networks, where we see these as regional, about 12, and we think that's going to improve services. So everybody knows what everybody else is doing. So I'm going to pass on now to Sir Cyril. But before I do, I'll just say on the payment system, this is something really needs addressing. And we are working on that at the moment. So Cyril, this is over to you.
There are 28 recommendations in the report, and they all fit together. So it's not going to work unless all 28 are paid attention to and implemented. It can't be cherry-picked, because so much of what produces safety is systems that work, and our recommendations are related to systems. That's my first point. My second point deals with choice and continuity and the record. Now, I'm a paediatrician. I know how important the Red Book was in my practice, and I know how important the paper maternity record is too. So when we talk about a digital record, one has to be conscious of the failed attempts to digitise the National Health Service record system over the last generation. So I'm not saying that we should ditch the paper record now. It's usually best to make sure the new works before you take the old out. Nor am I saying that we need to have some national scheme that is imposed on everybody, because we know that doesn't work. What we are talking about here is putting the mum and the family in charge. The record should be the mum's. And the professionals should interact with that record, the GP record, the hospital record, and that is now possible. It wasn't possible 5 or 10 years ago, but it's possible now through something called interoperability software. So on this slide, you see on the left-hand side to you the old system, on the right-hand side the new system. The new system enables the mum to record, the maternity record, to interact with all the other records that exist and are necessary to coordinate and integrate care. It's beginning to happen in certain places. We mention examples in the report. I chair a general practice in outer northeast London. We've set up such a system for dealing with people with chronic illness over the last year, and it works. This can be done, but it will be done by you, it will be done locally, but there is national initiatives going on to facilitate that. This is the experience of Sweden over the last 5 years. In Sweden, 5 years ago, they introduced a system whereby they made sure that after every poor outcome, a proper investigation took place, the learning was fed back to the clinical team, and a system for recompensing and supporting the families through an insurance system was available immediately to support them. So it all happens systematically. A poor outcome, a proper investigation, a rapid resolution and redress system to the family, and the learning fed back to the clinical team. If you work together, you train together. Now, the outcome of that has been, as shown on this slide, that over those years, the number of bad outcomes, damaged babies, has fallen from 20 per 100,000 live births to 5. 20 per 100,000 to 5. And that's what this slide shows. The current figure in England is 35. So we think that we ought to pay attention to this, and we should see whether we can't do what they've done. And part of that will be talked about through the morning and today about the working together, training together, learning, and so forth. But the government has accepted the need for a proper investigation on a no-blame basis, and they're looking very seriously at a rapid resolution system similar to the Swedish system. And that is set out on this slide. What would it mean is that we would get support to families immediately, not 5 to 10 years later, and we get the learning back to the teams immediately, not later. So 3 things. 28 recommendations need to be taken together. The need to introduce a digital system for dealing with the maternity care plan and the record, and a rapid resolution and redress system which will compensate or support the families and allow the learning to get back to the teams. Thank you.
Just finally to say, Cyril is absolutely right. We know a lot of reports are written. We see them on shelves, gathering dust. This one is not going to be, because NHS England, with Sarah Jane leading it, we have now built around Better Births an implementation report. Not only a report, but a doing. So we are determined this is going to work, but it won't work. Nothing will happen unless you people in the service really want it to happen and think about some of the complex issues that are here and how you're going to do it locally. Because you can only do so much from the top, too much from the top. It's got to come from the bottom up. And I just leave you with this thought. Chains of habit are too light to be felt until they are too heavy to be broken. So we have to discard our chains of habit. We have to embrace creative disruption. Uncomfortable, difficult, but we simply cannot go on adding and subtracting. We actually need a fundamental change, and it is up to you to see how we can achieve that. Thank you very much.